Hello everyone, my name is Roberto Borea. I am doing my fellowship in oncology at the University of Genoa in Italy. Today I am presenting at ESMO 2024 my poster did in my institution about circulating tumor cells and ctDNA on high-risk early breast cancer patient, the CITUCEL trial. So we perform some analysis at different time points on taking blood from patient before and after the surgery during the treatment. So we first focus on the CTCs analysis. So we analyze in two different ways. The first one morphologically and the second one phenotypically. So the first one we did a negative selection of the CTCs, and then we analyzed the size of the cells. And we saw in the results that if you have a lower amount of CTCs before surgery in the neoadjuvant population, you will have a higher percentage of PCR after the surgery. And this is, of course, very important for the patient, because in some subtypes of breast cancer, if you have a PCR, it can be prognostic. But this is not significant if you compare the data with the CTCs that you analyze the phenotype of the cells. So in the EpCAM positive cells, you don't see the same result. Actually, it's not significant. And we conclude within the first part of our project that it's very important when you choose the type of analysis that you want to perform and the type of instrument that you want to use to isolate the CTCs is very important. And this needs to be amplified, and new technology are coming, and we will try to get new instruments to do perform again this analysis to see which data we can trust more. And the second part, we did a fragmentation index analysis. That's basically a proportion of the long chain circulating DNA and the short chain circulating DNA. Because if you have a high fragmentation index, that means that you have a low percentage of short ctDNA fragments. You have a higher percentage of PCR, and that's again important in our for breast cancer patient in the neoadjuvant setting. But in our group, we didn't see this data. But we didn't stop, of course. We tried to understand why they saw this data significant and we did not. And when you check the cohort of patients, they have a higher percentage of luminal breast cancer. And in the meantime, we had only a higher percentage of HER2 and triple negative breast cancer. Because in breast cancer, we have three different subtypes. And in our opinion, is that you can use actually the fragmentation index in the luminal, but not in the HER2 and the triple negative breast cancer. Actually, we only recruited 32 patients, so the recruitment is still ongoing, and we will see with a new patient if the results is gonna to be the same or it's gonna change. So hopefully in the next congresses we will show the update of the CITUCEL trial, and you can contact me if you have any question about that. Thank you.